questions. Could you please describe for us what NICE is, what NICE stands for,
Yes.
and how that works in the UK?
NICE stands for the National Institute for Clinical Excellence. It's part of the British National Health Service. Mm-hmm. The National Health Service in Britain provides about 95% of healthcare. It's comprehensive, free at the point of need, and is funded by general taxation. And we provide guidance to the health service, in particular in two areas. We provide advice on the use of new interventions, particularly pharmaceuticals, looking especially at whether they are clinically and cost-effective. And the second thing we do is to develop clinical guidelines, pathways of care for specific conditions, which may include pharmaceuticals, and often does, but sometimes it doesn't. It's other aspects of care that are important.
Okay. Could you talk a little bit about the role that NICE has in nurturing emerging medical and clinical research in the UK?
Yes, I mean, quite clearly NICE wishes to ensure that the British people who use the National Health Service have access to innovative new products.
Right.
And we help companies we provide a service for companies to help them develop their drugs, their new products, in a way that will be appropriate for the approach we need to take in looking at both clinical effectiveness and cost effectiveness. We have also started, as a pilot study, giving advice to venture capitalists.
Right.
British venture capitalists came to us and asked us whether we'd be prepared to provide an analogous service to them. In the first instance, we're doing a couple of pilots with them, because we're not sure yet whether what we have anything to say will help.
Right.
But we're more than willing to try it.
Oh, okay. I was going to ask you a little bit about the venture capitalists approaching NICE in the UK.
Yep.
Why are they doing that at this point?
Well, they realise that it's not just a matter of investing in a product that will get marketing authorisation, as we call it, or a licence, but also whether it'll get reimbursed. And it's no good in investing in a product that's not going to have a cat and mouse chance of ever getting reimbursed. And so that's why they've come to us. Now, whether we can give them that sort of advice at a very early stage is something that we'll have to see.
Okay. What can emerging innovators, medical device innovators and pharma innovators in the United States learn from NICE, how NICE is going about the process?
When NICE was set up, the Secretary of State, who set it up, Frank Dobson, was asked whether he thought it would work. And he said, probably not, but it's worth a bloody good try. And I think when one sets up organisations like this, you've got to have courage, political courage, and the organisation has then got to earn and retain the respect of the public and the professionals, and we've managed to do that. So that's the message I would give America. Not how to do it, but those are the essential ingredients.
Okay, great. Thank you very much, sir.